Hello everyone, it's Rob. I'm on my student dietitian placement and I've just finished another week. So there's only 2 weeks left now. We've got the Easter holidays coming up next weekend as well, so I'll be missing the Friday and the Monday. I did my clinic today, telephone clinic, so I'll be missing telephone clinic last week. So I'm not sure if I'll be doing one on the last week either because we've got things to sign off. So potentially it was the last one, but I'll have to wait and see. So a full clinic, I had 7 people booked in, only 1 didn't answer, which I've been very lucky in terms of the amount of people who've answered. So just to give you some perspective, I know I've mentioned clinics before, but a lot of dietitians have mixed posts, so they'll work on the wards, maybe 3 or 4 days a week, and then they'll run a clinic dealing with outpatients for 1 or 2 days. So at the moment, all of the clinics are run over telephone. People used to come in face to face. I am told that when clinics were running face to face, we had something called a DNA, so did not attend, basically people not turning up for their appointments, which is a bit of an ongoing issue across the NHS in many fields. Usually, it wasn't uncommon for half the patients booked into a clinic not to turn up, which surprised me, but apparently that was common. Which meant that at least you had time to, get on with work in between them. But now, as they're telephone, and as I've noticed, we ring people, and obviously people do answer. So even if they had forgotten they had an appointment, it's still we can still conduct the appointment. Sometimes you can tell they're being caught off guard a little bit, and they say, "Oh yes, I remembered," but you can tell from either the sleepiness or the the environment they're in, that they're busy, that they're kind of going to wing it. And I have known other dietitians to mention that you can tell that people are conducting consultations when they're in public places, which isn't ideal. It should be somewhere private because potentially you're discussing private matters, but at the end of the day, that's up to the patient. So it was a mixed clinic. Had some patients who needed nutrition support, had a celiac patient for a review, had a mixed diabetes and nutrition support. So that's something I wanted to have a little chat about today in particular. I know I mentioned in the last video that we did the DAS session, which is the diabetes awareness. So I was able to take some learning from that was still fresh in my mind and apply to this. Something my supervisor mentioned, which was helpful, for these type of patients, it can be quite difficult because typically for most people, type 2 diabetes management involves discussing weight, especially if the patient's been putting on weight over a long period of time. Then that's quite a common theme and often one of the main causes for the diabetes. This particular patient is obviously under nutrition support, so it means they've been losing quite a lot of weight. They had a low BMI, so you can't take the normal approach that you would to encourage weight loss, because what we have to focus on is striking the right balance between the two conditions. And as you can imagine, although diabetes has its issues, especially over the long term, when people are malnourished, that can cause issues much more quickly. So it's important to try and build them back up. What we'll try to do is take that in the context of using more protein and fat as opposed to carbohydrates. A lot of the food first recommendations are very high sugar, just because it's easy, it's tasty, a lot of people get on quite well with it. Whereas for someone with diabetes, that may exacerbate their condition. So we'll focus more on high fat snacks, for example, so you can get lots of calories in that way. And then just, looking at their diet overall to see maybe we can make some small reductions in some area, but this has to be very cautiously done so we're not taking calories down. If it's someone who only eats carbohydrates, I think ultimately perhaps we'd have to accept poor diabetes management in order to keep their weight in a healthy-ish range, perhaps on a lower BMI. So interesting. It's like a lot of stuff. I know when I was training to be a paramedic, where you're told about clinical conditions, and you're kind of given someone who's got heart failure, and in your scenario they've only got heart failure. It's the only thing you need to worry about. So any signs or symptoms are going to be specific to that. But as is the real world, people have lots of conditions they're dealing with. So as health professionals, we need to learn to recognise, which is the main one, what do we need to focus on, and also take into consideration these other issues in our grand plan. So yeah, that was clinic. It went well, really enjoyed. I do enjoy clinics. It's something I hope to do more of in my time as a dietitian. Also wanted to touch on the next 2 weeks. So as I said, I've not got full weeks. There's only 2 4-day weeks. I'll be getting signed off with my folder at some point in the last week as well. So there's really not much time left now. It's gone really quick. I've had a good week on the wards, building more confidence, really enjoying having 2 wards to look after for myself and getting to see patients regularly. So I'll assess someone when they get transferred over to us, and then I get to go and see them on the next review. So really building up a good understanding of the patient's development over time, and in particular, something I commented to with my supervisor is that I get to see then, I put this plan in last time, how effective has it been? So I can see, I can assess and monitor my own plans, and that's kind of tailoring then. I know, oh, that didn't work particularly well last time, so maybe I'll do something different, or maybe I need to be a little bit more aggressive with treating people with supplements, because I know last time that a food first approach perhaps hasn't worked for someone with this lower BMI or with this poor an appetite. I've had some quite tricky patients as well. It's really hard, when someone just doesn't want to eat. There's no specific barrier. Something I've been working on is when someone doesn't seem to be eating very well and it's been ongoing for a while, is really taking the time to discuss with them, what can we do here? Are there specific reasons? Do you feel nauseous? Do you have pain? Is there constipation? And just exploring all aspects. So if we are getting to the point then where, our intervention just isn't working, that we can say that we have explored all possible options, and ultimately it is up to the patient then to decide to eat, to comply, or if they don't want to, then that's their choice. And unfortunately it is something we see as people get older, just that, the will to eat does go, and sometimes that is the reason people pass on then as well. It does seem to be, a natural part of life, but I think it's really important to recognise if there is a medical cause for it that we could potentially correct, and then, someone starts eating really well, that they feel better, their mood picks up, and they end up being discharged home and having, many months to years of happy life after that. So just important to cover all bases. I think that's really what I'm learning from working with like an older demographic in the community hospital at the moment. And we've had a couple of patients as well who've not done well, and they have sadly passed away. And it's sad, especially when you're involved in their care over a longer period of time. I think in the more acute hospitals, where you are only seeing someone once and it is very brief, it's part of it. Whereas at the community hospital, for all the staff involved, it's difficult. So it's part of working in the NHS. And I know it's something that's been a big part of a lot of people's lives recently as well. So yeah, that's kind of how it's been going. It's fun, it's insightful. It's a world that I hadn't seen a lot of. I always said before that dropping people off at the front doors as a paramedic, and you kind of wave goodbye, and they go on their journey, and you never really know what happens. I know we can try to follow up with stuff, but I've never been involved with the whole care process. So a big part of what I'm doing now is, really going through the notes for those new patients to see what their journey is. And yeah, some people have gone through a lot. You really feel for them, for people who've been in hospital for a long time. And the last thing I wanted to mention in this session, it sounds like I'm doing a clinic, in this video, is some of the extra things that have been going on in our department with regards to trying to improve the quality of the food on offer. So I've had 2 patients in particular the last week who've commented about how they're really not enjoying the food on offer. I know the NHS is notoriously inconsistent with the quality of food. Some people I've spoke to when I was a paramedic would be like, oh yes, great, it's best food I've ever eaten. So I think it's obviously comparative to what you're getting before. For patients who perhaps come across a little bit more as a foodie, who like to cook and make their own food and enjoyed food before coming to hospital, generally they're not particularly supportive of it, and don't have good things to say. I think some of the common issues are food being a little bit overcooked. So I did work as a catering assistant in a hospital for quite a few years, back home, back west, and I did recognise like some meals just don't hold well at a high temperature. So in particular, it's like fish gets really dry, gets quite hard, and that's one of the issues as well. I think some food being quite dry, and in particular as well, we've noted that there's not much fruit and veg on offer, or fresh fruit rather, that the patients can just snack on. So that's currently being audited, and we're hoping to put some interventions in place to increase the availability, and that's something one of my patients in particular picked up on. And what the supervisor's going to look to see is if there can be what happened there? Let's get those back on. If there can be a reduction in the amount of enemas and laxatives being given if we increase the availability of fresh fruit. So I thought, great idea, it's back to basics. there's going to be other benefits to that as well. And yeah, I'm sure it's going to be cost effective. So it'll be very interesting to see the results of that. So yeah, that's been this week. So 2 left. Got a nice weekend planned now. Me and the partner and the dog and the baby, getting to quite a gang now, are going to start doing regular walks. So I'm going to try and do some filming on that as well. And I just kind of want to share what we do, what we get up to keep fit and healthy, both physically and for our mental health. Because we used to go hiking a lot, and we've not been doing much of it recently, so it's going to be really nice. We went up the Garth, which is a big hill near Cardiff, last week, and it was great. Really enjoyed. Everyone had a good time. Baby's kind of like big enough now to support her head a bit more for longer walks, and she was good as gold. Really comfortable. It's kind of fun wearing her as well. So maybe we'll see some clips of her too. So yeah, that's for the weekend, and then Sunday cycles. Getting out on the bike a bit more now as well because the weather's getting nice. So yeah, that's the plan. Anyway, this has been longer than I'd anticipated, but I hope you find what I'm doing now interesting, and kind of give you an insight of either if you're a nutrition student or a dietitian student with placement coming up at some time soon, that this is some of the things you might be doing. Hopefully be seeing more patients face to face than we have, with things opening up now as well. So yeah, that's what's going on with me. So thank you very much for listening, and I hope to see you again in the next video. See ya.